I'll just introduce you there, Will. So we'll come through a background in occupational therapy. So Zane made the transition from allied health. And you've worked at J&J for 10 years now in the UK. Obviously, we can hear from the accent, and Australia. And really, again, started at that initial trainee territory manager position to now being a customer solutions partner. So I think people will be quite intrigued about your role and responsibility. So thank you for joining us, Will.
Brilliant. So I'll just double check that everyone can see my slides.
Yeah, just pop. There we go. That's perfect. Thank you.
Brilliant. So, look, for me, I guess my journey is kind of strange. So I don't want to focus too much on that. But you know, I certainly started out as a trainee territory manager. Worked as a rep through that. Did a bit of sales management, and then ended back up in the weird, wacky world of solutions and technology, where I guess I came from a very untypical background, and learned a lot in terms of, I guess, learning new skills, the critical importance of the teams that I manage, the teams that I work with, and the diverse thinking that comes with that, and essentially the importance of evolving our conversation, not just for us as industry, but also to our customers. So I'll go on a little bit about that. So firstly, about J&J. Look, I'm obviously, you've heard from Stryker. I'm obviously going to say that J&J is a great place to work as well. For us, like, it's a great place to work. We're certified, like 90% of people in J&J believe that it's a great place to work versus sort of 56% of a typical Australian company. And more importantly, when I talk about the diversity piece around being, I guess, a WGEA employee of choice for gender equality. And that's really important for us, as it is actually a lot of med tech companies. And diverse thinking in itself, from just, you know, looking at gender in different ways, those are the companies that are going to win, right? And actually my ask to you guys is actually really embrace that, like learn from the different people around you, because that is stuff that really makes a difference. And you know, Charlotte mentioned a little bit about jumping out of your comfort zone, and like tech, right? We're medical device reps. That's scary. But when you think about it and you break it back down, actually, it's not quite as scary as we think it is. It's about taking a jump and really understanding what we're trying to look at. So look, why is that important? So when people talk about tech, we often think, oh my goodness, it's going to be everyone coding in a room, and that's what tech is. The reality of that is, it isn't that. If I just look at sort of the little graphic on the side, there are people working in digital search. You look at digital search teams that support our doctors as we go. Communication, digital comms, that's another area in medical devices. The actual creative side, which is some of the stuff that I've done in terms of development and building apps and capabilities, but also the critical thinkers and practical and functional skills. Now, all of those different areas are important, right? And I would think if you look at all of those 5 things there, I guarantee you, every single one of you will have the ability to do a couple of those, at least. And while healthcare is evolving, we've got to evolve too, right? We've got to get more comfortable with this stuff. But isn't that a fantastic opportunity? Now, if you look at, I guess, the little graphic in terms of, you know, the different people that are all looking at the same 8 wave, infinity, whatever you call it, that is 8 different ways to solve a problem. So if I had 8 people who are in this room today, looked at the same problem, and they didn't speak to one another, I bet you get 8 different answers. And what an opportunity to find ways to understand how to solve problems. And I guess this is one of my big things, and I'm a big believer in understanding, you know, what's so important about people's differences. Would you want 8 superstars on the same team? Instantly, you'd think absolutely yes, but I wouldn't. I would want 8 very different people. And if I look at certainly the sales teams that I've worked with and managed, who have been successful, and they were brilliant, they had completely different ways of doing things. And for me, it's about harnessing that and actually learning to show you differences. You know, we talk about digital literacy all the time, right? And we say, well, that's scary. If you look at, I look at, say, back when I was selling sutures, I was pretty comfortable there, to be honest. It was great. I had a lot of opportunity, winning awards and stuff there, but I didn't know the granularity you could go about learning different stitches, or the difference between orthopedic implants. It's crazy. So I guess when we break it down to that granular level, digital literacy, is that actually that different to when you started learning about the medical device industry, or the complexity about what you thought was, say, a very simple product? I bet for the people who are speaking today, you could take the granular differences between different implant companies have got different things, and that actually in itself is incredibly powerful. But when you think about that from a customer standpoint, and we go back to that point on digital literacy, it's scary for them, right? We've already talked about robotics in surgery. What's the AI? What's the digital piece that's coming with that? Imagine you're a surgeon and you've done things the same way for 10 years, and all of a sudden the technology's evolved. There's a demand for robotics. There's a demand to digitally talk to your customers. It's new for them as well. And the role of, I guess, sales reps and the opportunities there is actually, how can you support and humanize that process for your customers as well? So I guess I've said a little bit about my journey, which was kind of a bit crazy. I think if I look at the teams that I worked in when I was a sales rep, I was always working with problem solvers. And that was the best thing about my job. Different ways of solving problems, enjoying solving the problems in themselves. But also on top of that, I think I look at when I was a TTM and I was learning products, and then I became that sales specialist and managed salespeople. I chose everything based on the experiences and the opportunities to learn. And one of, I guess, the least constructive things I'm going to tell you on this call today is, I actually, in my next role, I actually hope it doesn't exist, because that's where the market's going. Because if I'm in that role, I know we're being disruptive, and that's incredibly exciting and incredibly empowering. And, you know, I pointed out, is learning digital so different from the first time you walked into that operating theatre? It can't be that different, because I remember being in that position and seeing, I think it was a coronary bypass procedure. I was like, this is a different world. How can I ever learn all of this stuff? And in reality, you can't, but you can learn a section of it, as we've sort of spoken a bit about earlier. And I think if we look at, I guess, healthcare and how complex that is, we can't solve the problem by all thinking the same ways. You know, if we carry on doing things the same way, why would we hire people to do all things all the same? We just wouldn't. We just bring a robot in, right, to do that one job. So it relies on you as a team of people looking to come into the medical industry to actually find different ways to understand your customers, but find different ways to do things. Because that, for me, in terms of what I look for, is absolutely critical. So I guess if I talk about, you know, digital skills, and I guess, you know, one of the things that I hate, and it's overused, and I'm sorry, guys, you probably use the word talent all the time. I hate that word. I hate it, because it assumes that you've just got it. The reality of that is that's not the case. You learn, you become talented, you become skillful, which is a far better word, by learning your skills, by learning how to do something and actually working on your craft every day. Different ways of selling things, learning new technologies. It's all about that. And actually, rather than focusing on what I don't have, I can't be a programmer, or I don't have a digital marketing qualification. It's actually, if you go back and you bring it back to the basics of learning, all you have to do is want to learn. And I think Charlotte and I, and I'm sure it'll be brought up later on, have all both mentioned the same thing around learning from one another, right? Finding out who your different networks are, finding out different people. And I certainly, I guess I look at my role, which is focusing on building healthcare solutions for hospitals. I'm working at a level where we can sort of look at bigger, more complex solution rather than putting the implant in. It's how can we help a hospital to reduce length of stay? How can we make theatres more efficient and work at that level? I'm looking for a completely different skill set. In fact, I'm looking for people I don't know who could be in the market. I want people to look at things from a different way. And for me, the fundamental skill has to be that you guys want to learn. It has to be about being enthusiastic, about wanting to learn more. Maybe the future is a medical sales rep will look completely different. I don't know. And you know what? That really excites me. That really excites me. So look, if I look at the future, being comfortable with uncomfortable, that's the piece that always sits out for me. You know, if you're pushing your boundaries, you want to learn more. I've recruited people who, you know, are the people that were so tenacious they would meet me outside the front of the office when I finished work. And it was brilliant because it's a completely different way of doing things. And that was fantastic. I guess what helps you stand out against, say, other people is the ability to take your customers on that journey. You know, we've talked about the digital piece in itself. If you can humanize that process, if you can get your customers comfortable with digital, with robotics, say, with technology, if you can humanize that process, humans are built for connection. And actually, if you can harness that and really work on your customer focus, that is going to help you succeed. And that's what we can do better than anything. And look, rather than focus on, you know, specific qualifications, degrees, like what I would like to know, and I'm sure what other employers would like, is what makes you different from the next person? What makes you an asset? What brings something different to the team? Because that's the most exciting thing you can ever say to anybody who's recruiting for a role. What is it that you bring that is different? And for me, I guess that's that I guess intellectual curiosity, wanting to know more, wanting to understand actually what you can do differently. You know, tell me what I don't know, because if I don't know what I don't know, I'm never going to find out. So that's what I want to see.